Hello and welcome to my channel. Today we'll be talking about the male internal sex organs, so let's begin. The male internal sex organs are the prostate, the seminal vesicles, the vas deferens. These are the internal sex organs of the male. Today in this lecture we'll be studying the prostate. The prostate, it's a mix of tissues, glandular tissue plus fibromuscular tissue. It's present low down in the pelvis, behind the symphysis pubis, level with its inferior border, and right below the urinary bladder. It has a base that is facing the neck of the urinary bladder. It has an apex pointed downwards. It has an anterior surface, posterior surface, and two infralateral or two lateral surfaces. The base, as I told you, it's facing the neck of the urinary bladder, and of course it's pierced by the urethra. So the pre-prostatic urethra was part of the urinary bladder and then started the prostatic urethra by piercing the prostate and running through the prostate downwards and forwards to emerge from above the apex anteriorly of the prostate. The apex is directed downwards and in contact with the fascia of the deep transverse perineal muscles and the sphincter urethrae muscle, together called the urogenital diaphragm. It's in contact with the fascia and of this diaphragm, and it leaves the urethra leaves the prostate superior to the apex, not from the apex, and this is a multiple choice question. The posterior surface of the prostate, see in this specimen, this is the prostate, this is the base, this is the apex, this is the anterior surface and the posterior surface, and this is an infralateral surface. Posteriorly, it faces the ampulla of the rectum, separated from it by the prostatic sheath and connective tissue. We studied before that the rectovesical pouch in males, it has a redundant lower part that fuses together and forms the prostatic sheath posteriorly. It separates the prostate from the rectum. Has also superior depressions in it, marking the entrance of the ejaculatory ducts. See, each ejaculatory duct is formed by the union of the vas deferens and the duct of the seminal vesicle. Together they form the ejaculatory duct. The anterior surface, separated from the symphysis pubis by connective tissue and by the puboprostatic ligament, and by the prostatic venous plexus. You can see here the deep dorsal vein of Venus entering to drain into the prostatic venous plexus here, and covering also the fascia of the infralateral surface. Okay, so don't forget the puboprostatic ligament and the prostatic venous plexus, and that the anterior surface, the urethra emerges from it. See, this is the urethra passing through the deep perineal pouch, then this is the penile urethra starting. See that? Okay. The infralateral surfaces are related to the levator ani, or in this part, the levator ani is called the levator prostati muscles. We talked about this with the arrangement of the pubococcygeus part of the levator ani. The part where it forms sphincter vaginae in females and levator prostati in males. This will be related to this area. And the prostate is traversed by the urethra from the neck of the urinary bladder, and traversed also by the ejaculatory ducts, and contain the prostatic utricle, the one we will talk about now in the coming slides. Prostatic fascia, on the posterior surface, it's the fused part of the rectovesical pouch, as we learned before. On the infralateral surfaces, don't forget that it has the prostatic venous plexus in it and connected by puboprostatic ligament to back of the pubis. On the apex, it fuses with the fascia of the urogenital diaphragm, the sphincter urethrae, and the deep transverse perineal muscles, and the perineal body. So this is the fascia surrounding the prostate. Okay. Now there are two ways for sectioning the prostate. An old method in which they consider the prostate has an anterior lobe, posterior lobe, the anterior lobe anterior to the urethra, posterior lobe posterior to the ejaculatory ducts, and a middle lobe between the urethra and the ejaculatory ducts, and two infralateral lobes, one on each side. This is the old lobation system, but it's pure anatomical. There is another different way in studying the prostate is by the zones. But before we skip to the zones, don't forget the old way of studying the prostate was it has anterior lobe in front of the urethra, a posterior lobe behind the ejaculatory ducts, and the middle lobe in between the ejaculatory ducts and the urethra, as well as the utricle here at the back. The middle lobe is involved mostly in the benign prostatic hypertrophy or benign enlargement of the prostate, but this is more accurate if you use the zones system. The zones, here, as you can see here in this drawing, there's a peripheral zone. The peripheral zone contains the tubuloalveolar glands, the prostatic glands themselves, mainly on the lateral and the posterior aspects. As you can see, there are no glands anteriorly. They are deficient anteriorly. The glands secrete a fluid rich in phosphatase, and this phosphatase is increased level of output from the prostate in cases of prostate carcinoma or cancer prostate. So they use it as a tumor marker. If they are suspecting a tumor in the prostate, they just have to measure the levels of phosphatases, and if they found them increased, this is a prostatic tumor marker for the cancer prostate. Don't forget that. The fluid also contains fibrinolysin that counteracts the coagulative enzyme of the seminal vesicles, the coagulase. Because the ejaculation solidifies for a while, and then after that it turns into liquid again. Of course, this is after ejaculation. So these are the enzymes responsible for the shifting between the coagulative state and the dissolved state. It has a central zone that surrounds the ejaculatory ducts, as you can see here. It has a transition zone anterior that contains surrounds the urethra and responsible for the benign prostatic hyperplasia. See, so it's this part where they found the benign prostatic hyperplasia or benign enlargement of the prostate with age in this zone, mostly in this zone, which corresponds to part of the middle lobe with the old classification. Now there is a structure called the utricle, as you can see here. This is the utricle. It's the remnant of the uterus, the remnant of the Mullerian duct or the paramesonephric duct. Utricle and ejaculatory ducts curving around it is a cul-de-sac of 6 millimeter long. It's a fibromuscular sac and derived from the paramesonephric duct, as I told you. The prostate sheath on the outside of the prostate contains the venous plexus. By puberty, the size of the prostate doubles in puberty, and with age there is deposition of material, wear and tear material called the amyloid deposition with age to form what's so-called the corpora amylitia, very recognizable in the prostate tissue. Okay, now we talked about the benign enlargement of the prostate, but as it enlarges, it raises the uvula vesicae, you can see here, in the floor of the urinary bladder. This uvula vesicae varies, of course, in size in size with the hypertrophied prostate underneath it that actually pushes it up. So it acts like a valve. You see, the internal urethral meatus is in front of it. So if the one with a person with a uvula vesicae large enough that it can bend and occlude the internal urethral meatus, this is a problem. This is what happens in old age with benign prostatic hypertrophy, especially when they strain. The uvula obstructs the internal urethral meatus, so they have to relax, a lot before beginning to pass urine, as the uvula vesicae is not obstructing completely the internal urethral meatus. That's why there is a saying that you never stand behind an old man in the WC. You will make life harder on him. Okay? So this is the uvula vesicae part of the floor of the urinary bladder, raised by the transitional zone or the middle lobe of the prostate. Now, this drawing to show you the remnant of the paramesonephric duct. This is the paramesonephric duct, see, or the Mullerian duct. It degenerated because this person is destined to be a male, so the male hormones secreted more than females, so the paramesonephric duct started to degenerate, and see, its remnant is the utricle, because the paramesonephric duct was responsible for formation of the fallopian tubes and the uterus, but it's degenerated because this is a male. Will be a male baby. See, the remnant of the paramesonephric duct is the prostatic utricle inside the prostate that opens into the prostatic urethra, while the Wolffian duct or the mesonephric duct, see, this became the testis and this became the vas, and it descended down in the scrotum. Of course, the opposite happens if the baby was intended to be a female. See, this is a histology slide of the prostate. These are the cells lining the glands themselves. These are tubules coming out of the glands, and this is the fibromuscular stroma, as you can see here. And these are the corpora amylitia I'm talking about. The amyloid deposited along the years. It's a natural process. That's why the prostate gets big in size and hardened, the corpora amylitia. Now, there's part of the prostate inside part of the urethra inside the prostate, which is the prostatic urethra. The male urethra starts from internal orifice, that is in the neck of the urinary bladder, to the external meatus at the tip of the penis. This is the male urethra. Has a pre-prostatic part surrounded by the muscles of the neck of the urinary bladder. Has a prostatic part that traverses the prostate, more close to the anterior surface than the posterior surface, and emerges above the apex of the prostate. Okay? This is the prostatic part. Then begins the membranous part, and the spongious or the bulbous and spongious parts, or the penile urethra, till it ends in the external meatus. But this we'll be talking about later, and we'll just study the prostatic urethra, because it has certain features inside that belong to the prostate. That is the posterior wall. This is the prostatic urethra opened, see, from the front, and you are looking at the posterior surface. You immediately notice a urethral crest, see, by the underlying tissue, raised by the underlying tissue. This is the urethral crest, and approximately at the middle there's this bulge, which is called the Seminal Colliculus, or Colliculus seminalis. See that? It has a central opening called opening in the verumontanum. This is the opening of the utricle, coming from the back, and opens here at the summit of the Seminal Colliculus. While at the sides, as you can see here, see at the sides, two minute openings for the ejaculatory ducts, also open, and the Colliculus seminalis. Please, you will be asked lots of questions about this. Where do they open, and the name of the structures. So we have the Colliculus seminalis, or the Seminal Colliculus, with a central opening at the summit. Some books call it the verumontanum. It's for the opening of the prostatic utricle, while openings also in the Seminal Colliculus, but at the sides, belong to the ejaculatory duct. Of course, if there is an elevation, so at the sides there is depression called the prostatic sinus, and you see these minute openings in the prostatic sinus. These are the openings of the glands, of the prostatic glands in the prostatic sinus. So please do not forget this. In the sinus, the prostatic glands themselves open. In the Seminal Colliculus, the ejaculatory ducts and the utricle open, and in the middle there's the urethral crest. Okay? It's easy. So that was the prostatic urethra. To end our talk about the prostate, the blood supply of the prostate, of course, comes from the inferior vesical artery, or surrounding arteries also, like the middle rectal artery or inferior rectal. The middle rectal artery. So mainly from the inferior vesicle, and the venous drainage is by a venous plexus that's continuous with the urinary venous plexus. It's called the prostatic venous plexus, embedded in the prostatic sheath anterolaterally, here in this area, behind the symphysis pubis. Main tributary is the deep dorsal vein of penis, as you can see here. See that? Deep dorsal vein of penis. So if there is a coagulation in the prostatic venous plexus, this will affect the venous return from the penis, and this will make a partially erected penis, but erected, all the time it's semi-erected, but the patient cannot obtain erection because of the impaired venous return. This is the deep dorsal vein of penis, the main tributary of the prostatic venous plexus. It connects with the vesical plexus and the internal pudendal vein, and drains into the inferior vesicle veins accompanying the inferior vesical artery, then the internal iliac veins, and communicate with the external vertebral venous plexus at the back. That's how the metastasis from prostate cancer spread to the spine, spread to the vertebrae, the metastasis of the prostatic carcinoma. Okay, there are different ways that prostatic carcinoma spreads. This is one of them, through the blood, through the connection with the external vertebral venous plexus. Lymphatics go to the internal iliac lymph nodes, those of the seminal vesicle to the internal and the external, and from the vas to the external iliac lymph nodes. Next time, we'll continue our talk about the internal sex organs. We'll study the seminal vesicle and the vas difference. I hope you got the maximum benefit from this lecture, and thank you very much for watching.